Hi guys, I am back. My name is Rose again. Thank you so much for always checking me out. So in this episode, I just ended that. In the previous episode, I ended that where I got a diagnosis. Okay, if you haven't watched the previous videos, please make sure to go back because you'll be lost if you start in the middle. So go back, watch the previous three. I think there are three videos, so that you can be brought to speed. So fast forward, um, I get a diagnosis. Yeah, like I said in the previous video, I got a diagnosis, and this was a laparoscopy and hysteroscopy. If I get that well. Yeah, I got a hysteroscopy and a laparoscopy all in one. This was just one surgery. So after that, um, I thought that was it. Yeah, because this was about 6 hours in theater, and when I woke up, I was in so much pain. I was in so much pain. But thank heavens, I was in a place where I was able to get everything. I got a quick painkiller, and yeah, I think it went well. I was like, oh, thank you, Jesus. I finally get a diagnosis, and they tell me. So the doctor sits me down and he tells me, this is what we did, this is what we found. The endometriosis is on stage 4. Like I said, it was on stage 4, and I think that is the last stage. Yeah, that is the last stage. So she tells me, now we have to start treatment. So she tells me we have two options. We have an injection that you will take once a month, or we give you one that will last the entire time, so you don't have to administer once a month. I was like, since I am miles and miles away, I cannot make it every month. And of course, back home, those are medicines that are really, really expensive. So I was like, okay, just give me one shot and that will be it. So I was given an injection. I was given medicine called Lupron. You can go and check it out. It's called Lupron or Lupride. Yeah, this medicine basically is given to, normally it is given to cancer patients. So it is supposed to, so when they do the surgery, of course, when they remove the endometrium tissue that has gone where it is not supposed to go, of course, on camera, on the table, on surgery, basically, they cannot finish everything. So they will give you this medicine to like deal with the remaining, you know, tissues that couldn't be removed on the table in the theater. So that is what this medicine does. Basically, it's given to cancer patients to stay their body in a certain, I don't know how to explain it, like in a certain state, so that your body doesn't function the way it's supposed to function, because if it does, then it means the growths are going to come back, like the cancer is going to grow and things like that. So think of Lupron like the surgery is done. This one is supposed to like finish the remaining tissues. But what it does, it will put your body into menopause. Yeah, yeah, scary. To put your body into menopause, and I will not lie, it was bad. So if you have been diagnosed and you have been given these options, that is how it is. It is terrible. The side effects of the drug are terrible because, first of all, you're not going to be producing estrogen, because at this point estrogen is what feeds the endometriosis. So they'll make sure that your body is not producing estrogen, so that the disease is not fed and it does not reoccur. Remember, endometriosis reoccurs. So they give you this medicine so that it does not reoccur. The estrogen is killed by that medicine so that the tissues are not fed and they grow back. So what it does, it puts your body in menopause state, and it is bad. It is very terrible. You experience all the, you can go and Google, Chat, GPT, whatever, the effects of Lupron or the signs that come with menopause. It is terrible. You'll sweat when you're not supposed to sweat. It is terrible. The side effects are bad. That one I will not lie to you. They are so bad. And if you're a person that puts on weight, you are going to have to put on weight on that medicine, because remember, your body is not functioning the way it is supposed to function. So you have to exercise, you have to eat right, you have to hydrate, yeah, so that you can, live a full life while experiencing this. You're going to experience very bad hot flashes. It is raining, and all of a sudden you feel like as if they've poured heat on your body, and you sweat, and the sweat is literally running down your for like a split second, and then you're fine. It is that bad. And then you're not going to have a period for the entire time that you're on this medication. You're not going to have a period. So it was terrible like that. And I think this lasted for about 7 months, if I'm not wrong, because I was supposed to again go for checkup after a year. And whatever happened, and I did not go for checkup. Yeah, matter of fact, COVID happened, and I couldn't go for checkup. Yeah, I couldn't go for checkup. I just stayed there. And after about 9 months, my period returned, and I thought I was okay. I was normal. The pain was gone, thankfully. The pain was completely gone. The side effects were wearing away. Everything looked so good. Yeah, so I was supposed to just go and check and see, is everything okay? Am I like totally fine? But in those, after the surgery, guys, the pain completely went. I did not experience any more pain. And when the period returned, it was okay, it was normal, it was painless, everything was good. So I was supposed to go for checkup, I did not go. So when I finally got an opportunity, when COVID subsided and I was now ready to like go check and see what's up, I go. Yeah, I go. And guess what I find? I had developed a fibroid. Yeah, I had developed a fibroid, and I was like, oh God, like, what do you want from me? Like, what haven't I been through? Because I think that would be like the third surgery. So the doctor tells me the endometriosis is gone, every other thing is okay, but you have a fibroid, a big one. It's almost the size of your head. You guys. I was like, okay. So she's like, we have to take it out because it is big. I was at this point getting anemic. I was anemic. You guys, I was anemic. The normal blood levels for a normal human being are, I think, between 11 and somewhere from 11 going up. Mine was at 8. Yeah, I remember sometimes I would have to get, what is it called? I would have to get, not a transfusion, but iron IV. It was that bad because sometimes I would get dizzy. Yeah, and this was all caused by the fibroid. And in my thinking, I think when my body was in that state of healing from endometriosis, a lot was happening inside. And the fact that I was not getting a period, maybe, it's fueled the fibroid. I'm not sure what brought the fibroid, but I got a fibroid. And the doctor was like, we have to take it out because it is big. Yeah. So I had to go to theater again. So I don't want to bore you. The next part is going to be from there. When I got a surgery to remove the fibroid this time around. Yeah. So if you have been diagnosed with endometriosis, again, what I would like to tell you is don't worry. Now, right now, people know better, doctors know better, the technology is in place. Now things are looking better. Yes, me, when I got a diagnosis, there was nothing, especially in this country, there was nothing that they could do for me. So if you have been diagnosed, everything is in place. You're not the only one. Like I said, 3 out of 7 women experience endometriosis. So you're not alone. You will not be alone. People have suffered this before. So just seek help and you'll be helped and you'll live a normal life. Do not die there. Seek help because help is there. Again, if your period is painful, like more painful than it should be, that is not normal. You should get medical help. So I don't want to bore you. Please go and watch the previous videos to connect the dots. I'll end this here. And on the next video, I'm going to be talking about where I went after I had been told that I now have a fibroid. Yeah, it was terrible, but for a reason such as this. So it is all in history, and I pray that my story will help someone out there. If you're struggling with this, don't struggle alone. Reach out and get help. So I'll leave this here. I'll see you on the next episode. God bless you. Bye-bye.